here comes something that I believe some educational institution may be a part of it, or some completely uninvolved group of individuals. But for the most part, anything that robs us of our opportunity costs and ability to think freely without interference is no good. The healthcare and the subsequent developments and technologies like neural implants are designed to sustain um, our life expectancy as Americans uh, for whichever reason. Um, and the healthcare system and hospitals are situated to help maintain our state of happy and healthy, not to kill us or to figure things out or to see if we like oranges and bananas. And this has become a big problem because of some participation or um, interjection by the popular, which I believe has no place there. Because one, it sends a terrible message that this is a vanity thing or this is for superficial reasons, and it's not. As another communications device, that doesn't work. Because having one as having a concern for whatever the matter is, or a great concern for whichever the matter is an innate part of our existence. Whether you believe in God or not, atoms and neurons and the concept of space divided by outer space with completely completely void of form and with no mass there whatsoever uh, has a great concern for whatever the matter is. And so um, and it brings us to here. And that's a good thing. But vanity and other things are its antithesis. Like the idea of things in its place, a concern for whichever the matter is. Healthcare situates healthcare, doctors, nurses, professionals, and all those matters that belong to our health. Law enforcement, criminal justice, the government, those matters are situated within the scope of their jurisdiction. And they are concerned with the matters which they govern. That's important because it is vital that things that are concerned with whichever matter or what the matter is in its place, because one, it's situated to handle the complete breadth of things, and and they also handle how to uh, deal with the aftermath or whatever the circumstances.
The BRAIN Initiative, also known as Brain Research through Advancing Innovative Neurotechnologies, BRAIN, is a large-scale collaborative research initiative launched by the Obama administration in 2013. The primary goal of this initiative is to revolutionize our understanding of the human brain by developing and applying innovative technologies that can create a dynamic picture of brain activity. Key points about the BRAIN Initiative. Ambitious goal. Similar to how the Human Genome Project mapped the human genome, the BRAIN Initiative seeks to map the brain's complex network of neurons and their interactions. Collaborative effort. The initiative involves multiple federal agencies, private foundations, and research institutions working together to achieve its goals. Technological innovation. The BRAIN Initiative emphasizes developing new tools and technologies to study the brain at unprecedented levels of detail, from the activity of individual neurons to the complex interactions within entire brain circuits. Impact on brain disorders. By unraveling the complexities of the brain, The initiative aims to pave the way for new treatments and cures for a range of neurological and psychiatric disorders, such as Alzheimer's disease, Parkinson's disease, depression, and traumatic brain injury. In summary, the BRAIN Initiative is a groundbreaking research effort focused on understanding the human brain in unprecedented detail. By combining cutting-edge technology with collaborative research, the initiative aims to unlock the mysteries of the brain and transform our approach to treating brain disorders.
Um, Healthcare maintains our state of happy and healthy, changes how we feel about what our bodies naturally do. Heal. They're responsive, they heal themselves. But medicine, for the most part, in diagnosis, help us to feel differently, or the cells and whatever the broken bone is, to heal properly and to change how we feel about this phenomenon that is happening. If we cut our arm or something, the oxygen immediately causes a reaction, plasma from blue to red, instantly. Bodies are healing, are working, and and for the most part, our bodies don't impact when we like hit our head or something. The pain that we feel is not necessarily um, just pain, or uh, un- uncomfortability for the sake of uncomfortability, but instead it's our body responding and responding to this impact, and releasing chemicals and other and dopamines. Our body's feel, and that's its natural response. It's like emergency response. So that's great. Courts, for that matter, uh, any matter that is brought to light or rose to question will summons whichever uh, necessary, whichever requirements or material evidence that it needs, or um, for the most part, and is situated to hear matters, to um, hold people accountable or render judgments, and also they hold these verdicts and all these matters on a docket, or um, you know, bad guys go to jail, or they can help with matters regarding money and rewarding monetary rewards. That helps us to maintain a healthy and buoyant society that is root of intolerability, meaning those things that we have considered intolerable that are subsequently being heard, for that matter, in courts that divide community. Um, should people have opinions about things, because we understand that whatever the matter is, when you create a social discourse that is based off of a notion of intolerability, um, the potential harm it causes to everyone in society is very bad. Uh, for the most part, no one wants to be interrupted with a matter that is intolerable. That's why it's intolerable, and this can impose some disruption, or dividing community. Coming of age in like sacrificial lambs, and these represent taboos, or the sacrificing of taboos, and usually in like tribal settings, the sacrifice, to me, I believe, represents this sacrificing of the taboo instead of the human being, and this represents a rite of passage for the young man or woman. But traditionally, they're in like our communities, Afro Latino communities, they were like quinceañeras, but there's no sacrifice, or there's like a debutante somewhere, or sweet 16. um, But culturally, traditionally in Africa, this might be similar, a type thing, and that's important, because for the most part, like horror story, not horror stories exactly, but um, urban legends, or like villains, or Freddy Krueger, and even Edward Scissorhands, for the most part, represent this idea in society. Um, that is sort of like the antithesis to the coming of, the sacrificing of the taboo, or of the sacrificial lamb, but it's very similar. And this is vital in society, as a part of a social political divisiveness in entertainment, because what this does is, this helps us to really uh, get everyone involved in this political process that happens, that we find to be mundane or redundant, or sometimes cosmic in the effect that it's just really far out of the scope of our wants or need or interests. And so what these films do, and I would suggest subsequent programming does, is it compels, it plants dissonance in the minds of the viewers, and it poses the question of what would you do if. Usually, you see like the guy or the bad guy, usually like it's like burned up in society, and they're asking like, what do you do? Like, how do we, like stop this bad guy who's like in our dreams and everywhere. And this represents a very important part of society, actually. And it's a divisiveness that gets us in the mix of things, of actually voting, and participating in the political process. And this came from an abstract I was working on about anonymity, or community, the um, the idea of, or the continuity of communities. What makes a community, and how is a neighborhood? What makes up a neighborhood, and how is that different from a community? And uh, interdependency regarding our neighbors, and the American dream, and for the most part, the importance of anonymity in a neighborhood, um, is is important in our address system and zip codes, um, that sustains that whomever qualifies or earns it, gets first dibs on whichever place they want to live in America, and that's good. And so sometimes our jobs, if we're lucky, brings us to a place of our choosing, and not necessarily our knowing people. Um, and sometimes, if we're really lucky, we get to travel across the globe, and we may be bi-coastal for 3 or 6 months, and international, international for another 3 months, 3 months off. And so we may not get as much time with our neighbors, um, as much. So yeah, so still, this is taken care of by a process of voting. And so we understand that voting is a part of a larger system of entrustment, meaning, we feel free to walk around and stuff because we pay our taxes, and we hire a police force and all that. And so we should trust in ourselves, is the idea, instead of having this dependency or unrealistic dependency on our neighbors, because it doesn't matter. And this came as a result of someone believing that black, like 15% of, you know residents in this space are black, and that's a different reality from knowing that I'm an African American. One, and two, that's a different measurement. That's a measurement for marketing, or for demographics. And I'm not a demographic. I'm a human being, so I'm Patrick, right? So most importantly, we earn, or people have earned our time and know our names, or based on the work we do. But I'm not black, and I'm Patrick White, and we have completely separate experiences. My black experience is not your black experience, and for the most part, I believe that anyone's struggle out of any circumstance is a departure from an ability to our natural state or ability to nurture ourselves. And anytime you're struggling out of something or in something, you're either departed or incapable of really nurturing. And so on the home front, our homes are situated as spaces where we nurture ourselves. Everything we need to do is there. That's what the home is for. Period. Whatever you do after that is up to you. But it ain't called the boo boom room, the house over there with the hoo hoos and all of that other stuff. And that's still private. And so anything outside of the scope of that, you have symbols and unions and stuff that say, "Don't talk to me," boom, 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 and that privacy is or that continuity is realized there and in other ways. And that was an abstract of me realizing that whatever my preference or choice is, that having trans persons or LGBTQ plus individuals in my family or lesbian, what have you, in my family sustains that I am a part of that community because I have uh, a desperate need to communicate with my loved ones. And the more we communicate with our loved ones and communicating love and accommodation, then yeah, are the politics of or the ABCs or politics of LGBTQ plus. I just made that up. Then we can better accommodate our loved ones instead of losing them. Because of this breach in communication, and this thing that becomes taboo, this open secret or silent killer, because it shouldn't stop at I don't know what that is. That's a disease. That's something else. Bye, get out. You're nothing to me. And so that's where we find most of the I believe some of with some of the cases moving up from out of New Mexico with the highest number I think in the last 5 years, uh, according to a documentary by Latinos from New Mexico, the highest rates of incoming HIV/AIDS cases in that community. Um, that is affecting us in the U.S. on the East West Coast, and uh, on top of that, contribute to or affects the 5% population of African Americans in California. Uh, on top of in the last 5 years, uh, according to a documentary by Latinos from New Mexico, the highest rates of incoming HIV/AIDS cases in that community. Um, that is affecting us in the U.S. on the East West Coast, and uh, on top of that, contribute to or affects the 5% population of African Americans in California, uh, on top of staggering statistics about police involved shootings, which are by white police officers 50%, um, by our Latino counterparts a staggering 36%, and black on black crimes that are committed or homicides that are committed um, by African Americans against African Americans are, I believe, a cosmic.
Rate for the black population was about 40% higher than the statewide average in 2021. Life expectancy for African Americans is 5 years shorter than the state average. Specific causes of death: cancer. African Americans have the highest death rates for breast, colorectal, lung, and prostate cancer. Cardiovascular disease, heart disease, and stroke remain leading causes of death. Diabetes disproportionately affects African Americans, leading to complications and increased mortality risk. Maternal and infant mortality. Black mothers are 4 to 6 times more likely to die from pregnancy-related causes. Infant mortality rates are also higher for black infants. COVID-19. The the pandemic had a disproportionate impact on African Americans, with higher infection and mortality rates. Homicide. While data on specific perpetrator demographics can be limited, homicide remains a significant cause of death, particularly among young Black men. Suicide. Although historically lower, suicide rates among Black individuals, particularly young men, have been increasing. Factors contributing to disparities. Socioeconomic factors. Poverty, lack of access to quality healthcare, and environmental injustices play a significant role. Implicit bias and discrimination. Systemic racism within the healthcare system can lead to unequal treatment and poorer outcomes. Mental health disparities. Limited access to mental health care and stigma surrounding mental illness contribute to higher rates of suicide and other mental health related deaths. Addressing disparities. Addressing systemic inequities. Policies aimed at reducing poverty, improving access to education and healthcare, and combating discrimination are essential. Culturally competent care. Providing healthcare that is sensitive to the cultural and social needs of African Americans can improve outcomes. Mental health resources. Increasing access to mental health services and reducing stigma are crucial. Community-based interventions. Programs that address the root causes of health disparities and empower communities can be effective in reducing mortality rates. It's important to remember that these statistics represent a complex issue with multiple contributing factors. Addressing these disparities will require a multifaceted approach that tackles systemic inequalities and promotes health equity for all Californians.
Of African Americans in California, who, on top of staggering statistics about police and BOP shootings, which are by white police officers 50%, by our Latino counterparts a staggering 36%, and black on black crimes that are committed, or homicides that are committed African Americans um, by African Americans against African Americans are, I believe, a cosmic 20 some odd percent. So our